Today I am joined with Dr. Baskett from MUSC to learn a little bit more about how we can take care of our mental health. Thanks for being here.
Thank you so much. I'm so excited to be here with you.
Okay, so you are Columbia born and raised. You've got your roots here. Tell me a little bit about your path to medicine and what you do now at MUSC.
Well, I grew up here, right in Columbia. I used to live off Monticello Road. I attended Eau Claire High School. Wow. My mom was a nurse for the Department of Mental Health for over 35 years. Wow. So she introduced me to medicine. So I went to the Medical University of South Carolina for my education.
Oh my gosh, and now you work there. What a full circle moment.
Full circle.
That is amazing. So we'll slow down a little bit.
Yeah.
Mental health is a very taboo topic. There's
Absolutely.
a lot of conversation about it. What would you say are the biggest misconceptions about mental health?
Oh, there's several. One that I hear a lot is that mental health issues, mental illness is a sign of weakness. That is a myth. It is completely not true.
Completely false.
Completely not true. They are medical conditions that deserve attention and treatment. It's not something that needs to be hidden. It needs to be addressed, and it deserves the attention and the treatment just like any other medical illness, like hypertension or diabetes.
Yeah, it's just as important to talk about.
Just as important, yes.
You know, obviously, the earlier that you can get in to see someone, the earlier in this, mental health journey that you can go in and speak to a professional is the best.
Absolutely.
What are some of those early warning signs that we can see in ourselves, or maybe even people that we love, that to throw up that flag and say maybe it's time that I go speak to a physician about this?
Yeah, that is an excellent question. So the symptoms and the signs of having a mental health condition can be very subtle. You will overlook it. It's really easy to overlook. So you have to kind of pay attention. Is there something just not right in your life? Do you feel that something is wrong, but you can't put a finger on it? Have your friends, your family, or coworkers noticed that you're not behaving like you usually behave? And that you've changed something in your life? You've stopped doing things that you enjoy? I remember that I was in medical school at MUSC actually, and I had major depression. And I was in medical school and I didn't even know it.
Wow.
The symptoms were vague. All I knew was that I didn't feel right. I knew something was wrong. I emotionally felt bad and I didn't know why. Nothing happened. I didn't do anything wrong.
There's not a reason for it, right?
Exactly. There's not always an inciting or a triggering event. It can happen for no reason at all, really, what we call idiopathic. So I talked to someone because my friends and my family noticed you're not as joyful. You're not doing the things you used to do. I had a hard time remembering things, and that was one big symptom is that you have a hard time with your memory.
Right.
And you wouldn't think, oh, that's maybe depression, but it could be.
Right.
So I sought help, and I talked to someone, and I gave it attention, and I got treatment. And I got better.
Wow. Well, thank you for sharing your personal experience with it, because that's incredibly valuable. Sometimes there's other factors that play into your mental health issues, things like work environment, poverty, trauma. Can you tell me a little bit more about how those factors could affect the mental health of someone?
Absolutely, absolutely. So you first mentioned work, okay? Work may not be the cause of a mental health condition, but it definitely can trigger it.
Yeah.
So
it can be stressful.
Absolutely. That word you said, chronic stress, can trigger anxiety and depression and even other health issues. So hardworking people that are taking care of their families, they're working full time, they're taking care of their spouse, they're taking care of things in their community, and yet they have so much stress that they start changing. And they're like, you know what, I'm not joyful anymore. I'm not doing the things I used to do. I don't feel like myself. I don't feel right. That stress may have triggered a mental health condition.
Wow.
And they may need to talk to someone to see if they need to have a certain kind of treatment or maybe even counseling to help them with that.
What are some things we can be doing in our daily lives, practical things, to just make sure that we're taking care of our mental health and checking in with ourselves?
Absolutely, absolutely. So there are a lot of good things that a person can do, and that's just being mindful. How am I feeling? How are my habits? Do I feel like I am progressing, that I am thriving and not just surviving, doing life?
Yeah.
Okay?
Yeah.
And there are things that they can do to improve to improve their mental health, like just going outside. Go outside.
Yeah, get some fresh air.
Yeah, take a walk.
Yeah.
Yeah, take a walk and take a break from the screen.
That's a big one. That's a huge one these days.
When we're often silent and actually step away from the screen and all the noise, you can really hear your heart. You can really hear what your thoughts are and get a good pulse on where your mental health is.
Yeah, and that's really important. We so often, every single day, we're staring at our phones and we're not thinking much about ourselves at all. We're thinking about whatever's on that screen, so that's really good advice. If there's someone in our lives that is struggling, or we see those signs in them, how can we best support them through this journey?
Oh, that's a wonderful question. So first, recognize it, something's going on. I would speak with that person in private, and I would ask them, how are you feeling? Do you feel everything's going okay? Is there anything I can do to help? Sometimes that's all it takes.
Yeah, just a
and
conversation.
Maybe a conversation, and the friend and the family member may start to open up to you. And the best thing you can do is to be quiet and listen.
Yeah.
It's not your responsibility to tell them what to do. You're just to encourage them. Now, if they want advice, I would say, why don't you talk to somebody about this?
Right, I'm not a professional, but let's get someone who is.
Yeah, see your doctor, ask questions, just to see if there's anything that can be done to help.
Yeah, and my final question for you, is your practice open to new patients right now if someone is interested in coming out and maybe speaking with you?
Yes, we are accepting patients, and I am a family medicine provider for MUSC, and please call us. We will take care of you.
Thank you again, Dr. Vazquez, for being here and sharing this with all of us.
Thank you for inviting me.